Welcome to the AVAHO Carecast from AVAHO. I am Julie Lawson. I am the Executive Director for AVAHO, and I will be solo hosting today's episode. So I thank you for joining us and joining our guests. I'm excited to have 3 guests with us today, and I will let each of them introduce themselves, but I'm looking forward to a great conversation about what they're doing and the fun stuff they have going on in terms of their connection to the VA and connection to veterans. So with that, I'm going to turn it over. Evan, we'll start with you.
All right. Thank you, Julie. My name's Evan Chenault. I'm currently a biostatistician with the Durham VA. I've been doing that for about a month. And then before that, I was at the VA doing a data science fellowship called BD STEP, or the Big Data Scientist Training Enhancement Program.
Thank you. Palak.
Hi, thank you, Julie. So I am currently working as a surgical research fellow at University of Illinois, Chicago, where I'm mostly focusing on clinical research and translational research, particularly in surgical outcomes and oncological populations. I'm mostly doing study design, manuscript writing, working with large data sets, and yeah, that's what I'm doing right now.
Wonderful. And Hannah.
My name is Hannah, and I'm a clinic nurse coordinator at the Milwaukee VA. And I do a lot of coordination with our oncology patients and hemonc mostly.
Well, thank you for joining us today. And what our listeners cannot see is that you are all 3 relatively early in your careers. You're young. And so I'm so excited to meet someone who's a little bit on the early end of the career. Many times our members have a lot of experience and they have great information to share on these podcasts, but we don't very often get to reverse the roles and say, what's it like coming into the world now, into oncology and into working with veterans in the VA in today's world versus, 20, 30 years ago where some of our members may have been entering this field. So with that, I'd like to hear from all of you. What is your take coming in as someone on the early end of their career into the world of oncology and into the world of veteran care? We'll start with you, Palak.
Okay. So I have finished my med school 2 years back, and from then I've been working at UIC as a research fellow. And from there, I got to work with Dr. Alicia Hulbert, who has a VA appointment at Jesse Brown VA. So my main translational work has been with her in lung cancer. So it was a very welcoming environment, I felt, and we were able to access the data, the amount of patient samples we had. Even for the work I presented last year, we were able to get those patient samples from VA and all that information from the VA records. So I think it's a very welcoming environment at the VA. Everybody, it has helped me grow as a researcher, learn a lot of new things in oncology particularly, and even being able to contribute a little bit in this vast area of research has been a very good learning experience.
Evan, I see you nodding. What's resonating with you?
Well, I was just thinking about your question, like the time that we're entering the VA. And then I entered the VA through a data science fellowship. So my introduction to the field of oncology research was doing AI for large language models. That's kind of like my research project's main overall goal is to develop this pipeline. So I think that's probably going to be a little bit different than how it was 20 or 30 years ago. Yeah.
Yes, very different. Very different. Hannah, how about you? What had you go into oncology and into the VA?
Yeah, so my grandpa was a veteran, so like for me, the VA has always been something I've heard of, which was really great. So I was really happy to kind of get in there. And then my mom had cancer, so it just like really drove me into the world of oncology in general, just to learn more. And I think being new, and my grandma was a nurse, so it's really interesting to hear like when she was a nurse versus like now with me being newer, the changes, and especially in, cancer care, she was an oncology nurse as well. So to see like, you know, the updates in treatments and regimens and the survival rate for patients is really cool. It always like, we always talk every week and, you know, she tells me how amazing it is that, you know, these patients that used to like pass away so early on in their diagnosis are really making it a lot further now. And also with like the project I worked on for like distress, veterans are talking about it more, which is really cool. And I think really needed. And I think the stigma is becoming less and less. So that's also really, really cool to see as well.
That's interesting you say that. I listened to a podcast today of a veteran interviewing another veteran who just went through something pretty traumatic in terms of it was an active shooting. It's not related actually to his military duty, but he was present at an active shooting. And he said, "Are you getting counseling?" And the person said, "No, I'm just, kind of relying on friends and family." And I was interested that the podcaster kind of went after him and said, you need to go get therapy. We have it at the VA. That wouldn't have been the conversation even 10 years ago. Here you're talking about how they're becoming a lot more aware of how things are affecting them, how their health is being affected by the work that they do. So that's really interesting. I'm glad to hear that. I'm glad to hear that you are seeing a change also in that. So in terms of coming into this field, like I said, things have vastly changed. Evan, you spoke about AI. Hannah, you're saying, things are so different even than my grandmother. We're seeing research differences, and the data that you can amass is so different now than it would have even been 10 years ago. Which leads me to my question. The way that you got introduced to AVAHO was by doing a presentation for us last year, an abstract presentation. So I want to hear a little bit about what you presented on and what led you to present on that particular topic. So this time I'll start with Hannah and ask what your presentation was and what led you to want to look into that particular topic.
Yeah, so my project is on the distress screener implementation, and we did it via electronic e-screening. So again, kind of that difference in technology and utilizing it to help with our workload and leveraging that technology to complete that. So with our veterans for cancer, we were only screening about 4% of our veterans here in Milwaukee for distress. And obviously there's like so many times of heightened distress for them. And we realized we just really were not capturing that for them. So now we've implemented an e-screener that we send. So we created this database that we send out a week prior to their appointments. And they can check any concerns that they have, whether it's mental health, spiritual, any physical concerns, any religious concerns. They can fill all of that out. And then we will connect them with the appropriate referrals or tagging them to other notes. Our mental health tagging and referrals has been increased in the last year by 2,000% from the year previous. And we've had an increase of 140% more screeners being completed, which obviously, like even the 2,000% for our oncology psychologist is clearly showing a need, which is really, really cool that, we're able to capture that now, because obviously these patients were suffering in silence and we weren't capturing them. So, and anecdotally, we've heard, these veterans saying, "Oh my gosh, that was so nice to hear that," or just get something, just a little bit of confirmation that you guys care even more and that you guys really are looking for this. So it was really, really interesting to see it in like real time and to kind of consolidate their appointments. So if we're catching them a week prior on the screener and they need to talk to social work or they need to talk to the dietitian, we can group them all so they're not, tired of coming back and forth. We can do them all at once, which is really nice for them as well.
That is great. Evan, tell me about your presentation, your abstract.
Yeah, so our work that I presented on was looking at access that veterans with prostate cancer had to germline genetic testing. And then specifically our cohort was looking at veterans who were on the clinical pathways. So germline genetic testing is really important for veterans with prostate cancer, with more advanced prostate cancer, since it has implications for their treatment options and helping with outcomes and potentially other things like cascade testing. And then the, understanding of germline testing access throughout the VA was a little bit nebulous. So this project was kind of aimed at getting a better idea of, what percentage of veterans on the clinical pathways have access to testing. And then when we're talking about access, we're just, we're looking at whether a physician or other healthcare provider ask them if they would like to have germline genetic testing or not. So to give a little more context on the clinical pathways, these are essentially like these flowchart diagrams that were introduced by subject matter experts. And then in particular with the germline genetic pathway, that one came into existence in 2021. So also fairly recent, right? Keeping in line with that theme. So when you have veterans on these pathways, then you can, since they represents this sort of diagram, this flow chart, you can see when clinical decisions, treatment decisions are made. And then specifically for that, we would look at the part for germline testing, and then what marks these treatment decisions during a visit are what are called health factors. So essentially by looking at the distribution of the health factors in our cohort, we were able to determine, what levels of access to germline testing these veterans had, and as well as determine, who declined, who had a test ordered. And so I think that was pretty eye-opening because we saw that, there is quite a high utilization for veterans on the pathways, which is really good. That shows there's a high standard of care with them. And also when you get veterans on these pathways, that they do get the care that they need at a higher rate. So overall, it was a very positive finding. Yeah.
That is great. Yes, that's what we want. We want them on the pathway so that they are more successful in their total health outcomes, not just one specific piece of healthcare that they need. Palak, how about yours?
So my work focused on the exposome of the lung cancer in the US veterans. In that project, we basically aimed to understand how the environmental, occupational, and their biological factors interact with each other to influence the lung cancer risk. So we used like a multi-level approach where we looked at their occupational exposures they had while on active duty with their history. Then we looked at the different factors such as area deprivation index and environment burden index to look at how their residential addresses affected those things, and then eventually how those things together changed their DNA methylation in specific 4 genes. So what really motivated me to pursue this project was the realization that the lung cancer risk is different in veterans than civilians, because it's not just smoking, it's a lot of other different factors that's specific to their history and the cumulative exposures they have throughout the lifetime. So I was interested in to find this more comprehensive way where we can predict we can create these risk predicting models where we can predict the lung cancer risk in these patients so that we don't get them in the hospital when they are in the last stage, but maybe in second stage or first stage early on, when we know, okay, this person is going to be at high risk, and we could start those screening early on and those treatments early on. So yeah, so that was the project I presented last year.
Wonderful. Thank you. All of those are really interesting, and I think would be interesting for our members to learn more about. And so if anybody would like to follow up on that, let us know. We can share the abstracts with you directly. You can just email me at julie@avaho.org if you'd like to find out more about what they actually presented on. They were 3 of our top abstracts that were submitted. And speaking of abstracts, the abstract process is open right now, and we do this every year. So it is a way to bring research and ideas and practices that are exciting and novel and new, or for that matter, are best practices that are being proven to continue to be best practices into the academic environment at our annual meeting. And so it's a fun, I think a really fun way to explore some new ideas or new topics that you may have a personal passion for that other people didn't even know they were interested in until they read the abstract summary. What I'd like to know from you, now that you've given us an idea of what your abstract was about, is how that ties into what you would like to be doing in the future. And this could be any of you. It's not pointed at any one of you. But if you have an idea of what your next steps in your career are in terms of is this a subject that you want to take forward, or was it something you did once and thought, okay, I was interested in that and I researched it and I'm good? Or is this work that you would like to continue to do?
I can take this question. So I am really interested in being an academic physician. So this project especially was very close to me because a lot of times when I was on my rotations, I would see like a lot of these lung cancer patients would come at so last stage, and it was always difficult. There was no other thing that the physician could do. So I feel like this is something I would like to do so that I can bridge these population level exposures and these molecular mechanisms into real clinical utilization, where we could use these real world risk factors and predict how and make make it use it in a way where we could make our patients lives better. So that's how I feel I would like to tie it into my future.
Yeah, I feel like you said, caring for the veteran. And I think with my project, it's not anything revolutionary by any means, but I think it just identified a need and how, something pretty simple can make such a big impact. And I think for me, it's something that's, everyone I would like to think at the VA, wants to care for the veteran as a whole. And, it is really meaningful for them. And to me, it really is. And having, my parent, have cancer, it is really, really something that I'm really passionate about, is something making sure that we're taking care of all of their needs. And throughout their treatment and throughout, remission or advancing or end of life, making sure that we're meeting them at all of those stages for them and their families as well. So it's definitely something that I would love to keep doing. We've had it sustaining now, and I would love to keep doing it. So I know with Cerner, it'll be a little interesting, but I think we'll still be able to.
Yes. As we are recording, they are launching more of the sites for Cerner. So we will see how that integration goes. I will say, just from AVAHO's perspective, we are excited to see it kick off, and we are watching carefully just to make sure that it does what it needs to do for the patient, which of course is the most important thing. So
just to jump in. So the research I was doing, it was like my introduction into the field of oncology, and taught me a lot. And then so I think I'd really love to continue working in that field of research, and as well as kind of the future work, building off of what our group did, what I presented on at AVAHO, was looking at developing this sort of large language model pipeline. And that's just going to become more and more relevant, as we continue forward. And then so just being part of that process, seeing how it's done, learning those skills, I think translates to other fields of oncology seamlessly, and so many other areas as well, which are all, really important for, people just starting out at the VA. So that's, I think it was a great opportunity.
what do you wish people knew about your generation coming into healthcare and into medicine?
I would say one thing that I wish that more people the new generation coming in healthcare should think about is there should be an emphasis on collaboration and interdisciplinary thinking, especially in healthcare. Like it should be interdepartmental, working across the fields, integrating like data from all of those places and approaching the problems with like multiple angles. So whether that's combining like the clinical work with the research, or in like creating new frameworks. So yeah, I think that would be one thing I would say.
I think they shouldn't underestimate your ability to integrate technology into the healthcare process in ways that other people haven't done yet.
Yeah, and I think like sometimes it can be scary for sure. And my boss likes to joke with me that I'm the youngest old person that he knows, because I'm not great with technology, admittedly. And so I think it helps me see the perspective of, the different generations of veterans. But I think it also is important to kind of bridge that gap, right? And using it to help assist everyone and meeting people where they're at. I think working together and just being more open-minded. Because again, just because someone's like, newer or has more experience. It really just depends on what they what they know. And I think just working together to make sure we can utilize all of it will be really helpful moving forward in all areas.
I'm going to turn that question on its head, actually, and ask you, what kind of mentorship would be most meaningful to you?
I personally like intentional mentorship. I think it's great when they see, as someone who's really shy, I feel like it was really difficult for me when I first came to the VA. I was a new nurse, and I was new to oncology. So the combination was a little daunting because I came into a clinic with very, very, very experienced nurses, which was amazing to learn from, but also very intimidating. And being new as a nurse and in oncology, it was a struggle for a bit. But I think, working hard and having them be really intentional was really, really helpful for me. And showing me what opportunities there are and what resources there are, and just taking the time, right? Like, I think everyone is unique and everyone has strengths and weaknesses. And so kind of working in tandem with that was really, really helpful for me when I came in. And I think about like my mentor when I came in, and she was very patient as well with me. So yeah, that was really, really helpful for me.
I just want to assure you that struggle's normal.
To add to what Hannah said, she summarized it perfectly. I would say, like, with being intentional would be someone who understands like the goals I have and who would like try like support my career trajectory. And one of the biggest things in that would be like constructive feedback, who like gives me like it's a big part of it, who challenges me and pushes me to think critically about like what the impact of my research is, or the impact of the decisions I'm taking is. And I feel I got that, especially with the project I did last year. It was one of the first research projects I worked on. So especially at that time, finding a mentor who was able to give me guidance and give me that perspective to look at things from a broader angle was really, really helpful. In fact, like AVAHO was my first oral presentation I gave in United States, so which was a great experience in itself. Yeah, I think that's what I would add.
Yeah, and then I appreciated my mentorship. My mentor worked really close with me, and then spent a lot of time kind of echoing what Hannah mentioned, which I really appreciated because that kind of helps you feel more included in the VA. And of course, that time pays off, right? You're gonna learn more in those meetings, and they're paying more close attention to your research. So I thought that was, and clear communication as well made it was a big difference maker. So I think those things added together helped a lot. Yeah.
It matters. Absolutely. Absolutely. Well, on behalf of AVAHO, we are really excited to have you working with veterans, with the VA, and sharing the wisdom that you are gaining and the experience that you are gaining, but also the wisdom that you come to the workforce with. Like I said, every person and every generation brings a different perspective, different experiences. I am thrilled when we are the first place you do an oral presentation, or that you learn how to write an abstract with us. That's all part of the process of you succeeding in your careers. I have one more question for you, and that is, do you have any advice for people who haven't attended AVAHO? What would you like to share with them about maybe why they would want to attend the annual meeting?
I would say for the people who've not attended AVAHO, I would really recommend going, because it's not like other larger annual meetings or annual conferences. It's very intimate. So it's very easy to talk to people, to network, and build meaningful connections, especially as someone who's early in their career looking for mentors. I would say that would be a very good place for you to start at, as you can go and talk to people and people are very welcoming. So that would be my biggest advice to early career researchers, especially, or students coming to attend AVAHO.
Yeah, and I'd say AVAHO has a lot of different presentations to engage people from all different sides of oncology research. So a lot of it is very provider focused, definitely. But there was also, they were giving talks on AI, or they're giving talks, on these other aspects of oncology care that I feel like, anyone who works in any realm of this research subject could come and take away a lot from what AVAHO has to give.
Yeah, this was my first conference and my first abstract that I had written and done, and my first presentation. It was very, very nerve-wracking, I will say. But it was nice because I feel like we were all nervous together, and I feel like everyone was really supportive. So that was helpful. Not that I was like happy people were nervous, but it definitely made me feel better. But I think too, it was very intimidating, right? You have all these like intelligent people with so much experience, and it was very intimidating at first, but I think it was the perfect conference for me to go to. I mean, I'm new in my career, new into oncology. I've only been a nurse in oncology for not even 4 years yet. So I think for me, it was great, and everyone was so welcoming. And I think while it was provider focused, I think you can find the things that you're really interested in. The providers I work with do like lung and head and neck. So I really went to those talks, and also finding things that you could bring back to your facility to help and implement. And it was also really rewarding to get people reaching out after the conference to find out more about the project that I did, and how they can implement it into their VA. It was really, really nice. And I think, again, everyone was so supportive, and even the abstract process was very smooth for me. As, again, someone not good with technology, it was very helpful and like easy to navigate. And then everything was very laid out. So it was just a really good conference.
So what I'm hearing, and this is a good thing, we talked about intentionality. It is very intentional that we set up a multidisciplinary environment that is supportive. And so a thank you to all of our members who helped these three feel welcome and did not let them succumb to their nerves. But I'm glad that you felt supported and connected. That's the other thing that we want people to leave the meeting with is you can't get that online. That's just not something we can do with a virtual training. And so we still hold those in-person meetings for that reason. It's really important to feel connected to other people who work in the field and who are doing and experiencing similar things to what you're doing. So very glad to hear that. Well, to all three of you, thank you so much for giving us your time and your energy today and for sharing with us about your presentations. And I hope and encourage you to submit another abstract. We'd love to hear more from the projects that you're working on. And then that's a call for abstracts as well to the general membership who is listening. We want to hear from all of you. We want to showcase the best of what is happening in the VA and among our members. Thank you three again for joining us for this episode of the AVAHO Carecast. And thank you to those listening for your support. If you're not an AVAHO member yet, consider learning more and joining us at avaho.org. And stay connected with AVAHO and all our content by following us on Twitter at AVAHO Cares, Instagram at avaho.cares, and our Facebook at facebook.com/avaho.org. See you next time.
Thank you.
Thank you for having us.
Thank you so much, Julie.